Do you ever have abdominal pain, or does your belly stick out like you're pregnant, even when you're not? Do you ever have trouble holding your bladder, or do you have constipation? Do you have menstrual cycles that are so heavy and so prolonged that you would never dream of wearing white or wearing a swimsuit to the beach? Do you have a low libido? If you say yes to any of these questions, you may be suffering from fibroids. What are fibroids? Fibroids are benign or non-cancerous growths in the uterus or the womb. So they grow out of the muscle, but again, they're non-cancerous. They can range in size from being microscopic to being as large as a grapefruit or even a melon. Over 80% of women have fibroids, but most women have no symptoms from their fibroids. Fibroids are more common in black women, they're more severe in black women, and they occur at an earlier age in black women. Why is this? We don't know. But what we do know is that there are now many options for the treatment of fibroids. You do not necessarily have to have a hysterectomy if you have fibroids, and you very likely will still be able to have children. You can get over your fertility problems if you have fibroids. So in the next several minutes, I'm going to talk about the symptoms of fibroids, the signs of fibroids, some of the complications of fibroids, and the treatments of fibroids. What causes fibroids? The exact cause of fibroids is still not known, but we do know that fibroids tend to grow more when there's a lot of estrogen or progesterone in the system. So women who no longer have their periods or women who go through menopause tend to have less fibroids. What are the symptoms of fibroids? One symptom is heavy menstrual bleeding. So what is heavy menstrual bleeding? I find that a lot of ladies think that they're having normal periods because excessive and heavy periods are what's normal to them. But what a normal period should be is a medium flow of red blood with no blood clots, and the period should only last for 4 to 7 days. So if you're having heavy periods where you're having to change your tampon or your pad every hour or so, or if you're having blood clots, or if your periods are lasting for more than 8 days, then you have heavy periods, and this is a symptom of fibroids. Another symptom is anemia, which can happen from having heavy periods. So you may have fatigue, you may have very rapid heart beating, things of that nature from the anemia. Another symptom can be abdominal pain. Depending on the size or the position of the fibroid, you may outright have pain in your abdomen from the fibroids. You can also have a protruding abdomen or a belly that looks like you're pregnant even when you're not. And because of the position of the womb or the uterus where the fibroids are, you can get other symptoms like urinary symptoms. If, for example, you have a fibroid that's pushing on your bladder, then you may find yourself having urinary incontinence where you can't hold your urine, or when you're having urgency or having to go really frequently to urinate. Also, the uterus or the womb, it sits right behind the bladder, but it's right in front of the intestines or the rectum. So if you have a large fibroid that's pushing on your intestines or your rectum, you could have constipation. And yes, this could also be a symptom of fibroids. Another common symptom of fibroids is having a low libido or low sex drive. Another major issue that ladies have with fibroids is infertility, either trouble getting pregnant or trouble keeping the pregnancy. So infertility is another major issue with fibroids. So how can fibroids be diagnosed? Well, it's important to consult your physician, and fibroids can be found on physical examination, but to confirm the diagnosis of fibroids, you must have a pelvic ultrasound. There are many options for treatments for fibroids, but remember, if you have fibroids and you have no symptoms and no signs, then you do not need treatment. So if you have fibroids and you have no anemia, no pain, no fertility issues, the fibroids are benign, they won't hurt you, so no treatment is needed. If, however, you are having complications, signs, or symptoms from fibroids, then you will need treatment. You can either have medical treatment or surgical treatment, a procedure. Some medical treatments include hormonal therapy, such as birth control pills, intrauterine devices or IUDs, also some hormone rings like a NuvaRing. These things can help to shrink the size of the fibroid and also to decrease the heavy bleeding, which can help to prevent you from having the anemia. Another hormonal treatment is the depo shot, the depo-medroxyprogesterone shot. This can also shrink fibroids and decrease heavy cycles. In order to treat the anemia, you may be given iron supplementation, so iron orally and vitamins, or if your anemia is severe, if you have really low iron, your doctor may prescribe IV or intravenous iron injections in order to build that up and to treat your anemia. Some studies suggest that there are foods that can help with the treatment of fibroids or the prevention of fibroids. Foods that are high in vitamin D and in omega-3s, such as fatty fish or leafy green vegetables. Now, if medical treatments don't work for fibroids, you then have the surgical treatments or procedures. One surgical procedure is a myomectomy, where the fibroid is actually removed. Now, with myomectomies, there is a chance of the fibroid growing back, but the good thing about myomectomies is that ladies who are interested in getting pregnant and interested in having healthy pregnancies, you can have a myomectomy and still get pregnant and have a potentially healthy baby. There are different types of myomectomies. There is an open surgical myomectomy where the surgeon actually will give you a scar, very similar to a C-section scar, and go in and remove the fibroid from the outside of the womb. You can also have a laparoscopic myomectomy, where really there are just a very few small incisions and the fibroids are removed in that manner. If the fibroids line the inside of the womb, or if the fibroids are inside of the uterus, then that will require a hysteroscopic myomectomy, where the surgeon actually goes inside of the womb and they remove the fibroids that way. Another surgical or procedural way to remove fibroids is through a uterine artery embolization. This occurs when the physician goes through a large vessel in the groin and they actually find the artery that supplies the fibroid. They inject certain particles in the artery and they literally cut off the blood supply to the fibroid, which makes the fibroid shrink. It can shrink over a matter of weeks or even a matter of months. Other procedures include a laparoscopic, ultrasound-guided radiation frequency procedure to shrink the fibroids. And then ultimately, there's the hysterectomy, where the entire uterus, the entire womb, is removed.